us for today's webinar on the Addiction Evidence Project. My name is Amy Rowley-McGee, and I'm the president of the Health Policy Institute of Ohio. The mission of our organization is to provide the independent and nonpartisan analysis needed to create evidence-informed state health policy. We'd like to thank all of our core funders who make the work of HPIO possible. In particular, we want to call out a few funders who have specifically designated funding toward this project, Interact for Health, as well as the Cardinal Health Foundation and Premier Health for their support. This morning, I'll be joined by my colleagues, Amy Bush-Stevens and Haley Aka. They are the leaders of the Addiction Evidence Project here at HPIO, and they will be taking you through our most recent publication related to this project. Before we get started today, though, I'll cover some housekeeping details. The slides used during today's presentation, as well as a recording of the webinar, will soon be available on our website, hpio.net. During the presentation, please feel free to type questions in the question box at any time. There will be time for Amy and Haley to answer questions at the end of the presentation, and we'll get to as many questions as we can. If you don't see the question box, your control panel may be minimized. To bring it back, click the orange arrow in the corner of your screen. And now I'll turn it over to Haley.
Great, thank you, Amy, and thanks for all of you for joining the webinar today. I'm looking forward to introducing our first policy scorecard from the Addiction Evidence Project with you. So we know that many of you may be boots on the ground in this work and may have some more detailed knowledge of the policies and programs that we've covered in the report. We hope that this is an opportunity for a more big picture view of what's happening with addiction policy in Ohio. During the webinar, you're welcome to jump on our website. All of the reports and resources from the Addiction Evidence Project are available on the page of our website that you see on the screen. So today we're going to cover first the purpose and the process for developing the policy inventory and scorecard. We'll then dig into some of the key findings from the report, including the strengths and gaps in Ohio's policy response to addiction, our opportunities for improvement as a state, and then some changes that may be coming to the policy environment that will impact this work in the future. Finally, we'll share some key takeaways from an event that we hosted last month that focused on addiction prevention, treatment, and recovery. And then there will be time for questions at the end. So starting with the purpose for developing the Addiction Evidence Project. At this point in the crisis, we've heard the statistics on overdose deaths. We know that the death rate is incredibly high. We know that at this point, it's led primarily by increases in deaths from fentanyl and carfentanil. On this map, we see overdose death rates by state. The green states have the lowest overdose death rates, and the orange states have the highest rates of overdose death. And we'll see that Ohio is one of the states that's suffering the most in this epidemic. This is preliminary data from the CDC that shows us the percent change in the number of overdose deaths from 2016 to 2017. And we'll see that Ohio has had one of the largest increases in overdose deaths in that time. We are starting to hear reports from several Ohio counties that overdose death rates are starting to improve, that those numbers are going down. Now, we don't know if we'll see that reflected in the state data, which is due out in a couple of months. And then on the local level, we're not sure if this will just be a blip or if it's the beginning of a true downward trend. But it is encouraging to hear that news. It reminds us to continue to be diligent in this work. And it reminds me that policy change remains critical to continuing to improve. And that really is the purpose of the Addiction Evidence Project. The goal is to provide policymakers and other stakeholders with information needed to evaluate Ohio's policy response to the opiate crisis thus far, and to accelerate and continually improve strategies to address substance use disorders in a comprehensive, effective, and efficient way. The addiction overview and project description was the first brief released in the Addiction Evidence Project. That was released in December. And then the addiction policy inventory and scorecard was released in April. So some brief background on the Addiction Evidence Project. The project includes a series of online evidence resource pages, which bring together clinical standards, expert consensus statements, and evidence registries to show what works to combat addiction. Then following the resource pages, we're creating policy inventories that show what policymakers have done to address addiction in Ohio, either through legislation, regulation, agency initiatives, or other state-level activities. Finally, we're combining the evidence with what the state has done into a series of policy scorecards. The scorecards show the strengths, gaps, and opportunities for growth in Ohio's policy response to addiction. This is the framework for the Addiction Evidence Project, which emphasizes that many sectors are critical to moving addiction policy forward. The first phase of the project, which we'll be discussing today, focuses on prevention, treatment, and recovery. We plan to release products on each of these policy areas, and we're currently working on the inventory and scorecard for harm reduction and overdose reversal. To create the policy inventory, we reviewed state-level policy changes from 2013 to 2017, and in that time, we identified 193 individual policy changes, which is quite a lot even for these large areas of policy. Of the policy changes identified, over 40% were legislative changes, about a quarter were rules or regulations, and just over 30% were new or expanded state agency programs. Most of the policy attention in this time period focused on two things. The first is treatment services, so that's things like expanding access to medication-assisted treatment. The other is appropriate use of and access to prescription opioids. So these are things like changes to ORs and prescriber limits and guidelines. Less attention was paid to child and family-focused prevention, screening and early intervention, treatment system capacity and workforce, and recovery services and supports. And we'll talk more about those gaps in a little bit. Once we compiled the inventory, we reviewed it for specific evidence-based approaches based on our previous review of the literature. We then assessed the extent to which Ohio's efforts truly align with the evidence and whether our evidence-based approaches are being implemented in a widespread way. Once we had compiled all of that information, we were able to rate the subtopics within prevention, treatment, and recovery as having either strong, moderate, or weak evidence alignment and implementation reach. All of that specific information about evidence alignment and implementation reach is in our detailed scorecard, which is posted on our website. In the report itself, you see these scorecard summaries, which show the strengths, gaps, and opportunities for improvement in each subtopic for prevention, treatment, and recovery. So now that we've had some background on the report, let's discuss the strengths in Ohio's policy response to addiction. The big picture here is that we really do have many strengths that we can build on as a state. The first set of strengths is related to leadership, priorities, and partnerships. So on the leadership side, the General Assembly, the Governor's Cabinet Opiate Action Team, or GCOTE, and the Attorney General's Office have all done a great deal to address the opiate crisis over the past 5 years. On the partnership side, the crisis has really mobilized local communities and strengthened partnerships between behavioral health, healthcare, public health, law enforcement, and other sectors. I'm sure there are some of you involved in that work. And as you know, that's a really great foundation for us to continue to build on. Another area of major progress has been the reduction we've seen in the number of prescription opioids dispensed in the state. This is a direct result of a series of policy changes we've seen in Ohio, including improvements to ORs, which is our robust prescription drug monitoring program. We've also seen prescribing limits for acute pain and a series of prescribing guidelines for acute and chronic pain. And so even though we see this trend going down, it's important to keep in mind that we still have a long way to go. Here is Ohio situated among the other states in terms of the number of prescription opioids dispensed, and you'll see that we're still in the top half of states. So there's more work to be done in getting our prescription opioid number down, the dispensing rate down, but we are seeing that trend move in the right direction. Another strength to highlight is that Ohio has embraced medication-assisted treatment, which is a highly effective form of addiction treatment. Several evidence line policies have been implemented in the state, including Medicaid coverage of MAT and efforts by the Ohio Department of Mental Health and Addiction Services to increase the number of providers with waivers to prescribe buprenorphine. Buprenorphine is just one type of medication-assisted treatment. There are three, and those are the three that you see on the screen here. Another strength for Ohio is the reduction in our uninsured rate, which is largely due to expanded Medicaid eligibility starting in 2014. This has allowed thousands more Ohioans to access behavioral health treatment. Then the final strength to highlight is that many of the policies and programs implemented in Ohio over the past 5 years have been largely consistent with the evidence on what works to address addiction. For the scorecard, we really look to the most credible sources of evidence on what works, including the reports and the guidelines shown here. And we found that overall, Ohio has done a really good job of aligning with the evidence. But then that brings us to our gaps. And while we see Ohio implementing many evidence-based programs and services, in many cases, only a small number of Ohioans are being reached. So what we're seeing are these pockets of excellence cropping up around the state where great evidence-based programming is going on, but those programs aren't always reaching as many people as would benefit. One example of that is the MOMS program. MOMS provides care coordination and MAT to pregnant women struggling with opioid use disorder. There are currently 8 sites for the MOM program across the state, and there are plans to add 3 more in 2019. But we still see that there are many areas of the state where pregnant women do not have access to this program. Another example of this is MAT. So currently we still have 10 counties in Ohio where there are no medication-assisted treatment providers. Those are those light gray counties you see on the map here. In only 13 counties do we have all 3 types of MAT available, and those are the bright orange counties. In the other counties, there's a mix of 1 or 2 types of MAT available. In addition to what we see on the slide, only 32 counties have certified recovery housing, and there are drug courts in just 46 Ohio counties. So there's more that we can do to make sure that these evidence-based programs are available to all Ohioans. Poor pain management is another gap that we see in the state. So although there's been some progress in reducing opioid prescribing, there's much more that can be done to increase patient and provider use of and insurance coverage of non-opioid pain management. For example, there's limited use of non-pharmacologic pain management services, such as physical therapy, chiropractic services, and even less use of other physical activity interventions like Tai Chi and yoga. However, there is evidence that these kinds of therapies can be as effective, if not more effective, than opioids for managing pain. So there certainly are opportunities to continue to move in this direction. The third challenge is the patchwork approach to child, family, and community-based prevention that we see across the state. There are certainly many wonderful prevention programs happening in Ohio, both in the schools and in the communities, but we know that not all Ohioans are reached by these prevention programs, largely because they're often funded by short-term grants. So here's an example of that. This is the Good Behavior Game. The Good Behavior Game is a school-based prevention program for impulse control. It impacts both academic and health outcomes, including future addiction. In 2014, there was legislation in Ohio to provide 1 year of funding to 13 counties. To implement the Good Behavior Game and life skills curriculum. That funding ended. We currently have federal funding under the CURES grant that's being used for the Good Behavior Game, but that funding will only last for 2 years. So the short-term funding doesn't allow us to have a uniform, sustained prevention strategy across the state, and that's what we mean by that patchwork. There are going to be communities where there are gaps. The fourth challenge is inadequate treatment capacity. So this slide is really just one data point. It doesn't tell the whole picture, but it's the best available information for putting Ohio's treatment capacity in context with how other states are doing. So the bars here show the ratio of buprenorphine providers, which is one type of MAT, to the number of overdose deaths in a state. States towards the left have fewer buprenorphine providers relative to the need, which is signaled by those overdose deaths. As you can see, Ohio is the third worst when it comes to this ratio. A recent OSU study estimated that Ohio's current MAT capacity can only serve about 10 to 40% of those in need. So even though we have pretty good insurance coverage, certainly Medicaid coverage of MAT, it appears that we do not have a big enough behavioral health workforce capacity to meet the demand for treatment. And finally, there are a few areas of policy that there were just minimal focus on in the past 5 years. The first is tobacco, nicotine, alcohol, and other non-opiate drugs. These drugs and addiction to these drugs impact a large number of Ohioans. Another is recovery services, minimal focus on recovery services, which are critical to tackling the chronic nature of addiction. And then finally, we saw minimal focus on both health disparities and the social determinants of health as they relate to addiction. So now that we've covered our strengths and gaps, I'll turn it over to my colleague, Amy Bush-Stevens, who will talk about our opportunities for improvement and where we go from here.
Good morning, everyone. Happy Thursday. Thank you, Haley, for summarizing the strengths and gaps that we highlight in the report. And we would love to know if those strengths and gaps resonate with your experience in this work. So please go ahead and use the chat box or the question box to provide us with your comments and questions as we go along. In the report, we look to these strengths and gaps to identify 9 opportunities for improvement, and I'm going to walk through those now. So these are the first 3 opportunities for improvement. The first is around appropriate opioid prescribing. So this includes education, technical assistance, and other support for providers to help them operationalize the prescribing limits and guidelines that we already have. The second is around non-opioid pain management. So this involves patient and provider education and insurance coverage for some of the things Haley mentioned, like physical therapy, acupuncture, and other non-pharmacologic therapies. The third is strengthening community-based prevention. So this is really about sustained funding and improved coordination for school-based prevention and really having a comprehensive approach that includes all substances, not just opioids, and all ages. We need to focus on adults as well. These 3 opportunities get at both the supply and the demand side of the equation. So in Ohio, we've really done a pretty good job of focusing on the supply of opioid medications. We have seen that go down, and we certainly need to maintain and build upon that success. And of course, law enforcement has been very involved in seizing illicit drugs to help reduce supply. But we also need to be paying attention to the demand side and really have a more balanced policy response. So that means paying more attention to underlying drivers of demand. So things like pain and untreated mental health problems and poor economic conditions. So having a really comprehensive school and community-based approach to prevention can help us to address demand. Here's the next set of opportunities for improvement. So ensuring that evidence-based addiction treatment and recovery services are available for all Ohioans. This involves behavioral health parity and strengthening the behavioral health workforce. Number 5 is reducing disparities and addressing the social determinants of health. And number 6 is about increasing our use of data and evaluation to make sure that we're really focusing on improvement. And I want to focus just a minute here on number 5. This graph shows the percent of Ohioans who have a family member or friend who have experienced problems with drugs, broken out by income level. And you see an interesting pattern emerge here where we don't see a big difference for prescription opioids at the top, but we do see a bigger difference by income when we look at heroin and meth. So as the epidemic shifts from prescription opioids towards heroin and fentanyl and methamphetamine and cocaine, which we've certainly been hearing about a lot lately, it's really important that we keep an eye on this and be monitoring it in terms of health equity. These are the last 3 opportunities for improvement that we highlight in the report. strengthening clinical community linkages, focusing on the needs of children exposed to adverse childhood experiences, and then looking at the potential positive and negative consequences of medical marijuana legalization. And I want to say a little bit more about number 8 in a few minutes. Now we'll shift to looking forward. The future of this epidemic is certainly somewhat uncertain. And in the report, we identify several potential threats and changes on the horizon, such as the ones listed here. And I'm going to focus on a few of these. First, we have the whack-a-mole problem, and I'm sure most of you on the call are familiar with this. So we've seen the epidemic shift from opioid medications to heroin and fentanyl analogs and carfentanil and meth and cocaine. And so even if we were to eliminate the supply of opioid medications, we'd still be facing addiction challenges. So regardless of what the next drug is on the horizon, we need to be equipped with the prevention, response, and economic resources and social capital that are needed to prevent addiction. Second, we'll have a new governor next year, and so there's bound to be some disruption caused by the change in administration, but of course there are new opportunities as well. We also have the challenge of a generation of children exposed to trauma. These are the types of adverse childhood experiences, or ACEs, and ACEs increase the risk for a wide variety of physical and mental health problems later in life, including depression and addiction. And many of these ACEs are more likely in families struggling with addiction. The increased number of children in our child welfare system indicates that the number of children exposed to ACEs is increasing. And at the other end of the life course, we have a rapidly aging population in Ohio. And these two maps show the increase in the projected percent of the population over age 60. Older adults are at higher risk for pain and the negative side effects of opioids and benzodiazepines, including falls and cognitive impairment. So those are 3 trends that we think are important to keep an eye on going forward. And finally, there's another potential issue on the horizon I'd like to highlight. Overdose deaths are really the tip of the iceberg because they're easy to measure and track and they get attention in the media. But of course, for every person who dies of an overdose, there are many more who are struggling with substance abuse. And these deaths are really an indicator of many other factors that are just below the surface. And as Haley mentioned, we're starting to hear reports from around the state that overdose deaths may be declining in some counties, and that's really wonderful news, and we need to celebrate progress when it happens. But as the overdose death rate begins to go down, we need to make sure that our policymakers are aware that all of the things below the surface are still with us and will be with us for a long time. So we really need to be in this for the long haul and building a strong and lasting infrastructure to sustain prevention, treatment, and recovery for all Ohioans. That was a summary of the key findings from the inventory and scorecard report. And here are some ways that you can use the report in your work. And we particularly encourage you to share the executive summary with your legislators and other leaders in your community. Again, you can find the executive summary and the full report and additional detailed information on our website. So we encourage you to check that out so that you can make use of these materials. The last thing we're going to do on the webinar today before we get into questions is to provide a recap of the forum that we hosted in Columbus a few weeks ago. We had some great speakers who went into depth on the opportunities for improvement that we identified in the report, particularly related to pain management, behavioral health parity, and the link between economic conditions and overdose deaths. So I'm going to give a quick summary of their key points, but if you would like to learn more, we also have their full slide decks posted on our website. So if you go to the events page, or I think also a link from the webinar page, you'll be able to get to the complete presentations from these speakers. The first presenter was Dr. Ali Musharrab from the VA Medical Center in Cleveland. He talked about how pain management can be done safely with minimal reliance on opioids. And these were his take-home messages. He talked about how they've been successful in doing this at the Cleveland VA through these guiding principles. And they've been using an approach called Scan Echo, which involves virtual consultations between pain specialists and primary care providers to make sure that patients are having their pain managed safely. The second speaker was Kevin Malone, and he's an attorney with expertise in behavioral health parity law. Parity is the idea that mental health and substance use disorder services should be covered by insurance at the same level as corresponding medical and surgical benefits. The Mental Health Parity and Addiction Act, affectionately known as MAPIA, is a federal law that mandates parity. This is fairly complicated, so Kevin offered some resources that can help you if you're interested in learning more about this topic. So one is that an organization called Clear Health Quality Institute is developing a mental health parity accreditation program, and it can be used by health insurers and health benefit administrators to assess their compliance with MAPIA and any related state laws. So we encourage you to check out this website if you'd like to learn more about that. And here's some other resources that he shared that can help with parity enforcement and oversight. The last presentation I'll share is from Dr. Michael Betts, who's an economist at OSU. These were his key takeaways. He talked about the need to focus on the demand side of the opioid crisis, particularly local economic conditions. Here's one example of disparities related to social and economic conditions. And you can see that overdose deaths are more common among Ohioans with less education compared to those with a college degree. And Michael is an economist, so he shared lots and lots of data describing the decline in manufacturing jobs, median income, and income mobility. This slide shows the downward trend in income mobility in the US, and he recapped research linking these economic conditions to the opioid crisis. At the forum, we also had a series of roundtable discussions where participants shared information and lessons learned on a variety of topics. And folks had great suggestions for helpful resources, and I'm going to share a few of those. And again, these slides are going to be posted on our website, and so you can click on these links. The red text are links if you want to learn more about these. First, we have two regional initiatives that participants talked about, the Regional Judicial Opiate Initiative and the Central Appalachia Hepatitis C Coalition. We heard a lot about the need for addiction treatment. So this first set of resources is designed to help people find treatment providers. So two examples of interactive websites that help families to find providers. And the second is a set of tools from Shatterproof that are designed to improve quality of treatment and to help consumers find high quality providers. So great material on these websites. And then participants also suggested resources related to prevention. The first one here is for pain management. These are prescribing tools from Dartmouth. And the last two are for school-based prevention. This is the contact info for myself and for Haley, and we encourage you to reach out if you have any in-depth questions or would just like to talk to us more about the Addiction Evidence Project. And now I'm going to turn it over to the other Amy. He's going to wrap it up, and feel free, again, to be typing your questions and comments into the chat box.
Great, thank you, Amy and Haley. Now we'd like to invite you all, before we get to Q&A, to respond to a quick poll question. And reminder, you can either type your questions in the box. Okay. Overall, the quick poll question is, overall, how would you rate the quality of this webinar? So if you could please respond to that, then we'll get to the Q&A. And if you have any questions, please type them into the chat box. I see a question about, will the slides be available? Yes, they will be available on our website, hpio.net. All right, well, one question has come in, and thank you very much for responding to the poll. We appreciate that feedback. So the question is, are we aware of any counties that have had community forums related to medication-assisted treatment? This person says that in her area, MAT is controversial, as many people do not have all of the information. Do we have any recommendations on how to better inform the public on the benefits of MAT?
I'm not aware of any counties that have had forums specifically on MAT. I know that there are certainly organizations in the state that can be helpful with that in providing accurate information about what the research evidence says about the effectiveness of MAT, and that information could be helpful to share with community members. And so certainly there are experts at the Ohio Department of Mental Health and Addiction Services who could be helpful, and OACBA, the Ohio Association of Behavioral Health authorities. And then we also encourage you to check out our evidence resource page. So as part of the Addiction Evidence Project, we pulled together the most credible sources of information from national sources, including information about treatment and MAT in particular. And so some of the resources on that page might be helpful to share with community members. In particular, there's information from the Society for Addiction Medicine, and also the Surgeon General's report on addiction, as well as some other information that should be helpful to summarize what the research says, because there really is solid research showing that it's effective.
Well, I'd also like to urge any of you who are on the webinar who know of community programs that have happened to reach out and let us know about those so that we can share them with other participants. You could reach out to either Amy Bush-Stevens, Haley Aka, or to me, Amy Rowling-McGee. Someone just responded in the question box saying that Whitehall hosted a briefing on their program last evening, and they provided an overview of MAT and had 20 or so vendors present and distributing information. So there's one example of a community doing that very thing, and I'm sure there are other examples, and we'd like to hear about those as well. We have another question asking us if we can do an inventory of insurance coverage for non-opioid pain management. There are so many gaps in coverage for chiropractic, physical therapy, and out-of-pocket costs for these services versus out-of-pocket costs for prescription medication. So I'm going to allow one of my colleagues to respond to that, but I do want to mention that at the forum we hosted in June, we we had physical activity breaks that were specific to highlighting non-opioid pain and non-pharmacological pain management techniques. In particular, we had a chair yoga break, and a Tai Chi break, because those are both evidence-based strategies. And to my knowledge, there's no coverage for either of those two strategies anywhere. But Amy, what else would you have to say about that?
There certainly is a long way to go in terms of insurance coverage for many non-opioid pain management therapies, particularly the non-pharmacologic therapies. We did do a look at Medicaid coverage for non-opioid pain management, and also coverage for Ohio's retired employees, so coverage through OPERS. For evidence-based pain management therapies. So you can find that information in the detailed policy scorecard that's posted on our website. So you have to go into the very detailed document to find that information. So we do have that for Medicaid and for OPERS. We have not done it for commercial insurance, and I don't believe I've seen a really detailed review of that anywhere, but I would love to see that, and that's certainly something that we'll think about for a potential project to work on in the future. And if anyone else on the call has seen that, or any resources that would help us to pull some of that information, please share that with the group.
Another participant mentions in the question box that ODH had a bidders conference today on overdose prevention funding available beginning in 2019 through its injury prevention program. The question is, are we, meaning HPIO, working closely with ODH on this RFP? No, we are not, but I wanted to still mention it in case others on the webinar are unaware of that funding opportunity. You could seek out more information from ODH on that. All right, another question. Let's see, there are a lot of gaps in the availability of higher levels of care. For example, detox, inpatient rehab for individuals with Medicaid or no insurance. Are there resources that can be helpful? Is there anything being done to help create access to these services? Amy?
Well, we certainly, in doing this work, have heard a lot about gaps in care. And I think there are many different organizations that are working on this. I already mentioned OMOS and OACPA. There are other advocacy organizations in the state that are working on this as well, including MAC, which stands for Mental Health Advocacy Coalition. Okay, Health and Addiction Advocacy Coalition. Certainly, there are efforts at the state level to increase access to care. Behavioral health integration, behavioral health redesign is certainly intended to increase access to care. And as that rolls out, it'll be really important to be evaluating the impact of these changes on access to care and also quality of care and outcomes for addiction treatment.
Iterate the findings from the scorecard that we recently released. This is one of the areas where we have significant challenges still in our state and gaps in access to treatment. All right. Well, it looks like that covers all of the questions that we've had from participants. We appreciate so many of you joining us. Oh wait, I see another question. Let's see here. It's very lengthy. Oh my, I think it might be a paper, not a question. Yes, it's very, very lengthy, and I'm just scanning through to see if there is a question there. It doesn't. Yeah, We'll take a closer look at that after the webinar is finished and respond directly to the asker. But again, we're very pleased that so many of you joined us today. Remember that the slides that we used for today's presentation and a recording of the webinar will be soon available on our website, hpio.net. Please be on the lookout for the next report from the Addiction Evidence Project, focused on overdose reversal and other forms of harm reduction, which will be released this fall. Thank you again for joining us, and have a great rest of your day.